So proprioceptive input helps decrease the toe walking because it helps control body awareness. So this input is sent through the muscles in the joints, and the brain basically takes those signals and tells your body how to move next. So these kinds of activities are like jumping on a trampoline or heavy work activities. Heavy work meaning anything that pushes or pulls against the body. So walking around with something weighted can send input through the joints.
So the last reason we're going to talk about is idiopathic toe walking. Idiopathic toe walking is when after a physical and neurological examination, there's no specific cause, which often means it's habitual, so a learned habit like over time. Idiopathic toe walking becomes an issue if your child cannot place their heel down while walking at all, or they can place their heel down, but they walk on their toes for about 80% of the day. We'll get a lot of parents who often worry when they see their child walking on their toes when they're first learning to walk, but it's no cause for concern until the child is over 2 to 3 years old. So regardless of the reasoning behind toe walking can lead to issues like shortening of the heel cord, which can then lead to loss of range of motion. And loss of range of motion is bad because it leads to loss of function. This can affect developmental milestones like jumping, difficulty with going up and down stairs, stepping over objects, and falling more frequently. It can also lead to a lot of pain. So just imagine walking in heels all day long. Your center of gravity is pushed forward and you're constantly activating your back muscles, and being on your toes majority of the day, that will definitely cause some sort of pain in the ankles, knees, or back.
So what do we do in physical therapy? So it's a mix of manual therapy and exercises, right? So manual therapy is essential into regaining mobility if these kids have loss of range of motion in their ankle because they're always up on their toes. So soft tissue mobilization is done to the calves. That way we can relax the muscle and loosen it up. And then we do joint mobilizations to the ankle that will create space and make it looser. And then of course, a lot of passive stretching to the calves.
Okay. So other interventions. Of course, there's multiple things to take into account when choosing what activities are best for your child. But generally speaking, some activities are active and passive stretching, walking up inclines or walking backwards, stretching using your own body weight. So that's where squatting comes into play. And then single leg balance will bring the heel down, and that also strengthens the muscles in the hips. And then there's heel walking. Heel walking will strengthen the muscle needed to lift up the toes, which will improve walking.
So alongside with physical therapy, depending on the severity of the toe walking, AFOs can be prescribed by an orthotist, or serial casting can be done. So this is a picture of an AFO, meaning ankle foot orthosis. So it basically keeps the foot in neutral, but this is a hinged brace, so it gives the child more mobility to do activities like squatting because they are able to bend their knee more. And then this is serial casting. So this is a padded fiberglass cast, which provides a prolonged stretch. So they usually do this within like 4 to 6 weeks, and they can do like multiple rounds of increasing the amount of stretch each time they like redo the cast. So even when braces are given or casts are on, like we still do therapy while they're on. That way we can work on functional activities with proper form with their feet flat.
So wrapping up, the main goals of therapy are to increase ankle range of motion, increase strength, and then improve balance and coordination. PT also plays a big role in parent education. We will take the time to teach you exercises and proper ways to stretch your child at home, or ways for you to stretch at home if you're toe walking. So it's important that the exercises and activities are carried over at home, because consistency is key, especially when it comes to addressing tight muscles or breaking a habit.
Yes. So in the end, PT is important in helping your child. So if your child does toe walk, please don't be discouraged. It's something that we can work on together. So if you have any questions, that's all we have. So feel free to ask through the chat, or I don't know if we can unmute everyone and they can chat through here.
So what age should I be worried if my kid is toe walking?
Totally say it again.
So I would say it's no cause for concern until your child is over the age of 2 or 3 years old.
We have another question. How old does a child have to be to attend therapy? Any age. So we see a lot of babies for different reasons, but any age we see all ranges of kids.
So my daughter is 2.5 years old and she walks on her toes about 80% of the time barefoot, but in shoes she walks normally. Is this a cause for concern? So she's 2.5. So the age range is 2 to 3.
If they normally walk good in shoes, what we do in here is we start working on activities barefoot. So that way they know what that heel contact feels like without shoes. And then we can work on squatting and stuff, all that stuff with no shoes on. So if you want to start doing that, maybe see if that lowers the time that she's on her toes. So the question is, I feel like a lot of issues pertain to the pandemic, keeping my daughter home most of the time. Do you have any suggestions for different exercise along with squats that we can do? So like standing on one leg helps build ankle stability while keeping the foot flat. So if you want to work on some balancing, stairs helps strengthen the ankle while keeping the foot flat too. So if you have stairs at home, performing like sit to stand, so sitting in a chair, standing up, like doing that over and over. You can throw like a puzzle in there to kind of make it fun. The lower the seat kind of gets more dorsiflexion, which is where the foot, that motion of your toes getting pulled up. So that's what helps with toe walking. So let's see.
There's also like a lot of ways you can make it fun at home, like creating like a little like mini obstacle course with different types of material or different surfaces. Like
you can stack a bunch of pillows, blankets, anything that makes it like challenging for the ankle will work.
So the question is there an average amount of time that it takes to help them get off their toes? And I would say, it
varies.
Yeah, it varies from person to person, and it also varies on how much you're doing, like at physical therapy and then at home as well. So,
and I think it also depends on what their issue is. So if they're contracted because they're toe walking for so long, that will obviously take longer because it takes a lot to loosen up the muscle and the tendons. But if it's like habitual, it could be different, so it kind of varies child to child. So we got another question about exercises at home. So I'm trying to think of more things. So like sitting on a scooter board, like pulling yourself with your heels, that helps strengthen the muscles needed to lift the foot. So whether that's a scooter board or like if they're young and still have those like toy cars that they like push their legs on, or if it's like an older kid, Heelys are a good option because you have to go on your heels to like scoot. So that's a good one for older kids.
You can also strengthen like the smaller muscles in your foot, like picking up marbles with your toes, getting just that motion in the ankle, because you have to so pick it up and then bring it up and like place it in a cup. So just getting range of motion in the ankle.
So this question is, does having your child wear shoes at an early age, especially before they're able to walk on their own, increase the possibility of them becoming a toe walker? I wouldn't say toe walking essentially, but so they say you want to strengthen the muscles in the foot and the ankle like without shoes. So you build that stability at an early age. But obviously, when you're out, you can put shoes on. So I wouldn't say it increases toe walking, because when younger kids learn how to walk too, that's when they toe walk, because they're like feeling the floor and like it's a new feeling to them. So that's how they're like navigating how to take steps. But I don't think wearing shoes increases it. Okay, so sorry. Okay, we're reading on. Okay, so this one is, what are some things should I look out for if her toe walking is habitual? She does a lot of stairs with proper stance. She sits and stands often, and she just started a balance bike and is doing pretty well. I'm thinking it's habitual, but more insight would help. So when it's habitual, it's kind of just that consistency of cueing. So it's obviously going to be harder for a toddler, because saying like, oh, keep your heels flat is like, they're not really going to want to do that. And they're at that age, they just want to run around and do their thing. So it's kind of just constant cueing, unless it's like a sensory issue, then you can treat it that way.
And that's where, coming to PT would be a big play, so we can kind of do some things with her and kind of rule out certain things. And
then at the Cheyenne location, we also work with OTs. So if it becomes a sensory thing, we work hand in hand with occupational therapy as well. So what are the treatments you give for structural toe walking? I think manual is an important intervention. So coming to therapy is important, because we're trained in how to loosen up the muscles the right way and to create space in the joint. So, and then with structural, that often leads to bracing and stuff. So that usually, coming to PT kind of starts that whole process.
So Leilani says, so will wearing shoes a lot of the time affect sensory development for younger kids? Like, it's good for children to walk barefoot, like especially at home. You can also let them walk barefoot on like grass or sand, but of course you want them to be in shoes like when you go out, to protect the foot and have that stability. It's okay, Leilani.
I think a good mix would be,
especially when they're learning, like it's good to have stability, and then it's also good to have different.
You want to strengthen it without it, so I think a good even mix of the two.
These are all good questions.
Yeah, thanks guys. Putting our brains to work.
You're making us think.
Who can I contact to make an appointment? So at Optimal, we have a bunch of different locations, but the Cheyenne location where I'm at and the Winman one where Angeli's at are the pediatric based ones. So we have a centralized scheduling number. So I can put it in the chat.
Yeah, we'll type it in the chat.
So you just call this number, and then they kind of distribute where is necessary. Oh, she's got it.
Oh, there we go.
And then coming to PT, so referral wise, it's always best to have a referral, and that could be by any doctor, pediatrician, neurologist, whatever. But it also depends on your insurance. If some insurances can come without a referral, so you can still call this number or email that email, and they can verify your insurance beforehand, so you can find out for sure if you need a referral to come to PT. Yep, or request appointment on website. Thanks. You guys are so nice. Yes. I would love a back pain seminar. That would be amazing. I think we have like a bunch of topics scheduled out for the rest of the year. So that's one of them, right? Yeah. So stay tuned, follow us on all our social media, and keep updated.